Now we move to the next level, the global context of health. As we have seen going through this journey, how different cultures play, or what different culture, how different cultures play in those people who practice the culture in trying to maintain their health, and also what is the role of resources for them to really be able to experience good health. What are some of the challenges of nature, in which at times people have no control, like drought, floods, hurricanes, earthquakes, and yes, pandemics. So, how some of these things at the global level, how do we look at it? Do we look at it in isolation as, okay, the Western countries, everything being normal, they have the resources, they know how, the education, the resources to be able to meet their challenges, and ignore the rest of the world who cannot? Or is it advisable as individuals sharing the common globe that when it comes to health, it becomes a global concern? That was why the United Nations was established to deal with global issues. And in the United Nations is housed the World Health Organization, which is also a branch of the United Nations to deal with world health related issues. And within the world health related issues, you have departments in various countries that are there to be dealing, that are there to deal with the health of their countries. And break it down further, you have states. They have state secretaries who work hand in hand with the states, who work hand in hand with their government to deal with the health related issues of the state. Then you have the local communities. You have departments within the local communities that work hand in hand with the state as well as the federal government to deal with the health issues of the state. All through these years, especially the past 2 years, most of you have heard about CDC far more times than you've ever heard of CDC and its importance. Because even though we have the health and human services as the main department that is there to deal with the health of our country, but CDC is a branch. It's the scientific branch that oversees the health of our country. CDC is that area wherein the research is done. There is an outbreak, they go to work. What is this outbreak? Where is the outbreak? What is the cause of this outbreak? And how can it be prevented from spreading over? You see, because one of the things that has really become clear, the coronavirus did not have to be a pandemic. Let me say it one more time. The coronavirus did not have to be a pandemic. If people were prepared, there was a level of preparedness from localities to state level to the federal level. That is talking about how people in China should have really addressed this. If they had really treated it could have been an epidemic and end there. But because most of the world was not really prepared to deal with the coronavirus in a time-sensitive way, from what could have just been an epidemic became a pandemic with very, 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 very devastating outcomes. Many lives lost, many dreams gone, and we're still dealing with it. So when it comes to talking about it and health in the global context, I think one thing that we all have to be ready is preparedness. We know these things are going to come. As long as we keep moving around, we keep dealing with all sorts of animals, we keep exploring places, there is a possibility for us to contract certain diseases that originally we are not really programmed for human beings. But if we are prepared, we know that these things can happen. We have our scientists, our epidemiologists ready. When something is detected, they can say, something is up. Let's get all of our gears ready. It's because what has caused this great suffering to mankind world over was simply because people were not ready. And unfortunately, when it started, people started not being truthful about the disease. So time, sensitive time, valuable time was wasted. And let's don't kid ourselves. Today is COVID-19. Tomorrow there's going to be another COVID. Or something else. two different situations that could have been a real disaster: the Ebola and COVID-19. The Ebola, at least, it was more of an epidemic in West Africa, in one part of Africa, contained. People knew, people trust the science, people knew how this disease could be spread, and they made sure they take all the possible guidelines to prevent the spread of Ebola. And less people died as compared to COVID-19. See, this is a lesson, especially for us in public health. We professionally, people were ready. But when it comes to what the resources available, the type of messaging, the whole thing, the commitment, I don't think we were ready. We allowed stupid politics to take over. Instead of science, people were believing political spin. And because of that, a lot of lives lost. It took time for people to say, okay, let's stop the political nonsense. Let's listen to science. Let's do what science says so that we can be able to address or control the impact of this virus. And that is true for a lot of, as I said, there are going to be other diseases that will challenge the world. Are we ready? When the other COVID comes out, are we ready? When another Ebola comes out, are we ready? Or any disease X comes out, are we ready to just keep it controlled immediately before it spreads all over the world? Are we ready to share our resources, our talent, so that those countries that have share with those countries that do not have, so that we stop the mutation of this virus? Because right now there's the possibility for developed countries to have their in the populations vaccinated. Are we going to provide those same resources for those countries that cannot afford the vaccines, the vaccinations? Because if we don't, we will not be able to get rid of this virus because it will mutate. It will stay longer with those countries, poorer countries, mutate into other forms. And because of our habit of transportation, people travel. Now we start calling them this the British virus, the Mexican virus, the Indian virus, the Florida virus. This, because again, we travel. There's an advantage of traveling, but also there is a disadvantage because when we travel with our suitcase and everything else. And we also travel with some of the microbes that we pick up from the place that we're traveling from and come to other places and deposit those microbes that can infect that population. So this is just an overview using uh, most recent issues when you talk of the global context of health. The bottom line is there is no country is safe when it comes to this kind of issues until every country is safe. And one thing that when things like this happen, countries have to be forthcoming. Don't lie. Don't lie because you want to save face. They have to comfort, be truthful of what they have experienced because it helps scientists to really work when they know what they are working with. We waste time when they have to find out what is really happening. And one thing with this diseases like this that are so contagious, time is of it's of essence in trying to combat or reduce its impact. It's extremely important. And all countries should work hand in hand. Those who have and those who don't work hand in hand to address this disease. A good example of global right now, okay, you listen to the news, how COVID-19 is really causing so much pain and death to people in India. And when you listen to those people who are really giving commentary, who are the scientists, who are the doctors, a good number of them are Indians in America, who some of them, in fact, when they explain, they cry because they're losing family members in India. In as much as the world is ready to use the resources, the talents of other countries for its own good, we should be able to use those talents and resources to solve some of the challenges faced by some of those developing countries. Because if we don't do that, we are kidding ourselves. We might think the problem is solved, especially for developed countries. Problem is not solved. Maybe it's taking a pause, and that's going to be another outbreak. So we have to be prepared. Preparedness. We have to be ready. It's almost like firefighters. They always check all the things they need. If there's an fire outbreak, they are ready to mount on those big trucks, run to the site to put the fire off. But if we are not ready, the fire truck does not have water, enough water, or the fire truck does not have a good driver, that fire will not be put off. What could have been a destruction of 1, 2 acres can be 10, 20, or 1, 2 houses can be 5, 10 houses. So the essence of preparedness is very, very important. Public health professionals have to be prepared at all times to deal with global health issues, regardless of the country from which it originates, because after some time, the issue will not only be that country, the issue will be the very country that we thought this will not happen. So the essence of preparedness is very, very important. Health is valuable for every human being. Without health, there's nothing. And COVID-19 has exposed a lot of inequalities in the world, a lot of biases in the world, and has also exposed a lot of goodwill among human beings. But a lot could be done. Because if we fail to do those things, it's going to happen again. And we have nobody to blame. We can call names, but you know what? You're okay by calling names, and these people feel bad and whatnot. By calling names, you are creating it out worse problems. All you need to do is get our public health system in place, get our hospitals ready, get our scientists ready, trust in what they come up with, and you will see how fast we can address some of those things. Avoid conspiratory messages, confusing messages. Come up with one message so that when people hear those messages from reliable sources, they can respond appropriately. And for us, it's CDC, the Centers of Disease Control and Prevention. Control and prevention. The prevention piece here, prevention, part of the prevention is the readiness. How to make that prevention much stronger. It does not cost that much than when to control when the disease is already out. It's now taking lives. If we can just do an effective way of preventing the onset of the disease, we will do better whenever there is another outbreak. Because it's not a matter of never, it's just when, from where. Okay, some of the, we go with this is now chapter 11 and 12 to demonstrate how the global context influence individual health. See this whole thing going back to the Ebola situation, sorry, the COVID-19 started ways from somehow in China. Now it's impacting people's health in Chester, Virginia. Miles away. Certain things along the way have been done properly. Some other things have not been done properly. Thank God now we are at a point wherein messaging has improved, intervention strategy is improving, and people, a good number of people are listening to the guidelines that have been provided. And the level of politics that was introduced at early stage is slowly coming down. Science, yeah, politics can help science to be better. Politics should not minimize science, because science helps everybody. Science do not carry a title, a Republican or a Democrat or a Libertarian or whatever. It's those things that are there, the information that scientists come up with to improve the health of the human race. And we can see also how this COVID-19 has really shown the light of the inequality. First, let's start inequality within different populations in America. How a number of minority populations have succumbed to this disease. And when you take it to at the global scale, same. See, there's a big gap between the inequality when it comes to health, education, health resources. And we should try to minimize, to address some of those inequalities. We should take racism away from the issue of health. We are all human beings. And to a certain extent, we all believe that, okay, depending on, you have a lot of people use God when it shoots their, whatever they're talking about. But when it comes to the fundamental core, we are all children of God, and therefore we have to be responsible in treating every person equally, provide them with equal opportunities for them to do well, for them to improve their health. That also becomes even at the global level. So those countries with money, with means and resources, they've developed vaccines and now they are vaccinating their populations. Those countries with some countries without the means, they are still dealing with some of the basic needs, just trying to survive. See, now you have some countries almost moving to having excess vaccinations, and some countries having none. Again, this has to be looked upon as a universal issue, a global issue. It has to be shared so that everybody is given the opportunity to have good health. To illustrate how globalization impacts upon health in a number of contradictory ways. Most of the time, people are much more big on, oh, we favor globalization when it comes to taking resources from other countries or exporting certain things to other countries. But when it comes to providing the necessary help, the necessary resources to those countries, globalization becomes less favored. Again, if you're going to take resources from countries, raw material, to develop their own country, you also have to be willing to provide assistance to those countries so that they can improve their health. Because countries will not exist or will not be as productive as they could if their health is not taken care of. Why is global health important? Health is bound up in global relationship, the global context in which we are all located influences our health. The notion that we live in a global society is supported by evidence showing that trend and relationship exists between health and well-being in many societies across the world. So most of the time, it becomes much easier to help countries in the Western world. It's much easier for America to provide immediate assistance for London, England, and some of those Western countries. It's somehow a bit challenging to provide health for some developing or underdeveloped countries. See, it shouldn't be that way. Whosoever is in need should be provided the assistance in a timely manner. See, because a healthy country is a productive country. When the country is healthy and also has the appropriate level of education, that is a country that can produce. its own resources, its own food, and can produce its own scientists, its own lawyers, its own medical doctors, so that when there is need, they can rely on some of those their own. But when a country is not healthy, it's not as productive, it's not as educated, always has to rely on external sources when there is either an epidemic or a pandemic, then that's a challenge, not only for that country, but for the whole world. And some of those things, when we talk about the globe, some of those things should be addressed. Individual health is increasingly conditioned and determined by both global processes and relationships. There are a number of health problems and issues that requires tackling at the global scale, hence the need for global solution. Say, for instance, smoking. Smoking cigarettes is a global challenge. It's a global health problem. If it's going to be resolved, it has to be challenged at a global scale. Its production should be stopped rather than creating restrictions and shipping things to other countries, shipping cigarettes to other countries. It cannot be solved that way. And right now we have this COVID-19. It has to be solved. Okay, people have come up with local solutions. Now it has to be scaled to global scale. Come up with global solutions. How can this be solved? Okay, I stop the class here and we will pick it up. We will pick it up here the next time, and in the meantime, please read the chapter because this is extremely important, especially at this point that we're dealing with the COVID-19, where we went wrong, where countries went wrong, and how prepared were countries. Because as with any challenge, the more prepared you are, the better you are to be able to solve the issue. The less prepared you are, the more likely that it will take you time to come up with a solution. And in the process, you'll be faced with a lot of hurt, a lot of pain.